Hello, everyone, and thanks for joining us today for the next presentation in our series of webinar forums on managing stress. This is a joint production of the Department of Psychiatry, the University of Iowa Hospitals and Clinics COPE program, and the Employee Assistance Program. I'm your facilitator, Dr. Laura Fuller from the Department of Psychiatry. I have important information to share about this program. This webinar is provided for educational and informational purposes only and does not constitute providing medical advice or professional services. If you think you may have a medical emergency, call 911 or go to the nearest emergency room immediately. No provider-patient relationship is created by this webinar or its use. Neither the University of Iowa nor its employees nor any contributor to this webinar makes any representations or warranties expressed or implied with respect to the information provided herein or to its use. We are excited that you've joined us today. If you are watching the live stream version of this program, there will be time for a limited number of questions at the end of the presentation. Please use the chat function to submit questions. A recording of this webinar and further resources will be available at the Loop on the hospital website. Our presenter today is Dr. Eva Schoen. Dr. Schoen is a clinical assistant professor in the Department of Psychiatry at the University of Iowa Hospitals and Clinics. The topic for today is emotional eating and stress. During her presentation, Dr. Schoen will teach us about an aspect of COVID-19 that we have been hearing a lot about, stress eating. It seems lately I've heard many people ruefully talk about the COVID-15 that accompanies this pandemic, referring to the 15 pounds that are gained by some people as a side effect of being stressed out, working from home, and from being unable to do normal daily activities such as exercise. Today, Dr. Schoen will share with us ideas to help us manage stress and become less vulnerable to using food to stifle our stress. Here to tell you more without further ado is Dr. Schoen.
Thank you, Dr. Fuller. I'm really glad to be here today. This is an important topic during this time, and I'm glad to be able to discuss it with you. I will cover the following in my talk. What is emotional or stress eating? So the definition. Secondly, what is the connection between stress and eating? And then finally, I would like to share some strategies with you about ways to reduce emotional eating. I have two disclaimers to make. I will not be talking about ways to diet or lose weight. The strategies I will be sharing are about adequately taking care of yourself physically and emotionally. And my second disclaimer is that I will not be describing the emotions as positive or negative, as good or bad, as they are neither good or bad. I believe that all emotions are important and there's space for all of them. And especially during this time, we have many emotions, many pressures, many stressors that are with us. And so especially during this time, I'm going to encourage you to be compassionate with yourself. So for definition of emotional or stress eating, I'm going to use that synonymously. Emotional eating is the tendency to eat in reaction to difficult emotions and experiences, such as sadness, frustration, disappointment, worry or fear, and a big one, stress. Emotional eating can also mean emotional overeating. This is defined as consuming a larger than needed quantity of food in reaction to certain emotional states. There's often a correlation between a pattern of overeating and the experience of difficult or distressing emotions. It's also interesting that people do not typically overeat in reaction to physical hunger unless they have let their hunger go way too far and are essentially starving at the moment. So what is the connection between stress and eating behaviors? Really, I believe the connection is through the physiological experience of stress and the psychological experience of emotions. Emotions and eating are intimately connected for us, and actually oftentimes in very helpful adaptive ways. Think of the many emotional social experiences related to food. We celebrate with food. We provide food to grieving families. We give treats to our children as rewards. Each of these examples shows that eating is a way for people to experience social and emotional closeness, reward, comfort, in short, pleasant emotions. So emotional eating is a concern when it's eating in reaction to stress as an attempt to manage or decrease this distress. And emotional eating is also a concern if the amount, timing, or type of food eaten is not what the body needs or can process well at the time. Also, emotional eating is often associated with an experience of guilt or shame after the eating episode. One of the reasons why people may be struggling more with stress and emotional eating right now during this pandemic is the fact that there likely is more or a different kind of stress than we're used to. There may also be more or stronger emotions, such as grief and worry, than during quote-unquote normal times. So the combination of high stress and an abundance of difficult emotions can certainly make it more challenging right now to manage our eating. Many of us have more food available in our homes than is typical. Some people may have less access to the foods they're used to. Daily schedules have changed for many of us. Routines are different, new, or really ever changing, or there may not even be a semblance of a routine yet. And all of these changes create more stress and more emotions for us to deal with. And so we try to deal with them as best as we can. Stress creates unpleasant feelings and sensations for us. And as I often tell my patients, as human beings, we are hardwired to attempt to reduce uncomfortable feelings and sensations and to rebalance our systems. In fact, I'm still in awe of the human ability to try to rebalance, to try to mitigate uncomfortable feelings. While stress sometimes shuts down our normal hunger signals and people lose their appetite or refuse or restrict their food intake as a way to numb away from their emotions and their stress, emotional eating is really the opposite coping attempt, a way to reduce stress by consuming too much food or consuming it not at the right time. So as you can see, eating has the power to induce a different set of physiological experiences from the ones that stress induces. Eating can at least temporarily reduce or eliminate an unpleasant internal experience and instead create a more pleasant internal experience. An example I thought of for this is when eating sugary foods creates some sort of a sugar high. Or another example would be the sense of warmth and physical relaxation that comes from eating foods that contain tryptophan, which is contained in turkey. Many of us associate this feeling probably with a lazy afternoon on Thanksgiving Day. Food can have this powerful effect on our bodies and psyches. It can be used to exaggerate emotions, numb emotions, reduce stress, induce energy, induce sleep, you name it. Eating is really one of the fastest and easiest, quote unquote, coping strategies we as human beings can use to deal with stress. So not always an ideal one. So now I would like to share with you some strategies to reduce emotional eating. These strategies are really strategies to reduce emotional stress. And when we manage emotions without reaching for food, that then allows for food to no longer be the main player in one's approach to stress management, and rather to take on an adjunctive role in that process. As an example, eating some chocolate or grabbing some chips in the evening can still be an important part of someone's day, a part of the unwinding routine that I'm certainly going to still cherish, but it is no longer the main or the only way that the stress from the day is being managed. I'd like to now go over some specific ways to change an emotional eating pattern. I have come up with 3 steps in this process. The first step is increasing emotional awareness. The second step is using stress and emotion management strategies. And the third step is really nourishing with food. We cannot change our emotional experience without being aware first what our emotional experience is. And so in order to increase emotional awareness in the moment, there are some strategies we can use for that. One would be to do a daily check-in with yourself. It could be in the morning when you get up, could be at a predetermined time of the day, or just when you're kind of feeling a physical sensation of stress, and checking in with yourself to ask yourself the question, how are you? How are you feeling? And really listening to the answer. It's also important to learn what different emotions feel like for us. Not everybody has the same experience of sadness. Not everybody's able to distinguish what sadness feels like versus maybe anger or despair or distress. And so learning what different emotions feel like for us can give us an increased sense of awareness of ourselves. And then in addition to that, identifying which emotions are most linked to your own drive to eat. And so it could be for some people that it's boredom. It could be frustration or repressed anger. It could be eating as a reaction to sadness. And so finding out more about, for your particular system, how emotions and eating are linked. What are your particular emotional triggers to go and reach for food? Again, in this emotional awareness raising process, it's important to accept all emotions as important and meaningful. There are really no bad emotions, as I said before. They're important emotions, and they give us really important information about what's going on for us. Another step in this emotional awareness raising is learning to distinguish between physical and emotional hunger. Physical hunger is usually centered in one's body, and it comes with physical sensations. So the gnawing in your stomach, the low energy, feeling of kind of emptiness in that stomach area, maybe symptoms of low blood sugar. Physical hunger is satisfied by a variety of foods and is often nonspecific. It's the time at 4:00 in the afternoon after a long day of work when I just look through my office drawers to find something that I've stashed there. And any food will do. Just need some energy at that point of the day. Emotional hunger is centered more in your mind, and it's more like a craving. It often involves rumination about a specific food. It's often about that wanting that specific food and nothing else will do. Might also be craving a specific food group, like craving something salty or sweet. And finally, just the practice of mindfulness and mindfulness in daily life. And I know some of my colleagues have talked about this before in these talks. There's some really great online resources as well for practicing this. My second step is really using these stress and emotion management strategies that we all have. First of all, if there is unnecessary and unhealthy stress that can be prevented, I'm a big believer in that. Secondly, tracking your stress level a bit, especially during this time right now, and also tracking your stress coping for a few days or a week could give you some really good insight into how your body, how your mind are working together and what's happening with your stress level, looking at the patterns. This is also a time to practice self-compassion and to let go of perfectionism. With additional stress, additional pressure on us, sometimes and really oftentimes doing things good enough in a good enough manner is all we can do, and that is truly good enough, acceptable, and good. This is also true for food intake. This is probably not the time to practice 100% perfect eating, clean eating, etc., etc. It may not be the time to really work on a long-standing pattern of emotional eating. It may be a time to just keep working on taking adequate care of yourself. One of the emotional management strategies that I like to share with my patients is the question of what you really need at the time. So thinking about in the situation that you're in as you're getting ready to grab some food, thinking about what you actually really need when you're feeling this feeling, and then using a specific coping strategy to match that emotional need can really help shortcut that step to eating and change the direction of the behavior. So if the feeling is one that's really physiological, so hunger or thirst, then definitely the right coping strategy is to eat and hydrate. If the experience is fatigue, being tired, then resting or at least slowing down, taking a nap, getting up from your chair, walking around, and also working on maybe getting more regular sleep would be a really important coping strategy. When there's physical pain, physical pain and fatigue are often cues for us to eat emotionally as a way to make our bodies feel better. Instead, really working on that pain relief in other ways. And then the emotions like sadness, anger, et cetera. So for sadness, asking for support and allowing time to really feel that sadness, allowing time to grieve and mourn. When there's anger, finding a safe place to vent or finding a journal, a way to write things out, working out or taking control back over the situation. For loneliness, and we're all cooped up in our homes, or many of us are, maybe reaching out more, engaging in a regular gratitude practice, or giving to others in one way or the other. Boredom, which is a big trigger for emotional eating, finding things that are of interest. And again, based on that question of what's your real need here right now. If the need is, I need some stimulation, I need something to get me going, then developing interests, working on interests and hobbies would be important, and also helping out. And then the experience of being scared or worried, that would be a focus on the present moment, practicing mindfulness and practicing resilient thinking, really staying in the here and now, asking the question, am I safe now? Am I okay now? Is this manageable right now? And then the third step is actually nourishing with food. And so we can do things with our food intake that can make it easier to not eat emotionally. And one of those really important things is to follow a regular eating schedule and eat sufficiently for what your body needs. That really rules out the impact of physical hunger on your eating because you're taking care of that hunger. And then it makes it easier. There's more energy, more space there to deal with the emotions when we're not also contending with physical needs of hunger. Really importantly, and I've been seeing this more and more, is that people are finding joy in cooking and baking and also joy in eating. Eating is supposed to be a positive experience in our lives. With that comes also challenging the diet mentality. That's a mentality that sometimes really makes it hard for people to enjoy food because it's all about less is better and thinner is better. And we would say that less is not better and thinner is not better. So really challenging that diet mentality and thinking of food as fuel, as nourishment. And when you're reaching for something, really asking yourself, how can my body use this food? What will my body do with this particular food? How am I nourishing my body with this food? And then eating when you're hungry and stopping when you're full, which is an intuitive eating approach. I also have a note here at the end. If someone experiences a lot of struggle with emotional eating, and for those suffering from eating disorders, this can be really a particularly challenging time. And if these self-help strategies don't work, I would encourage you to consider reaching out for professional help. That is available even during this time, and I would encourage you to get the help that you need. And that concludes my suggestions and my talk.
Thank you, Dr. Schoen. That was wonderful. It's very nice to hear so many strategies that people can use. There are a few questions. One is that, you talked about how much of eating is actually hunger versus emotional in our experience. And I think that a lot of people have a go-to response when they're feeling stressed, when they're feeling different kinds of emotions that are uncomfortable. And I hadn't really thought about how much people have a go-to kind of thing that they do going into the cupboard or into the pantry or whatever. So what can people do to kind of bring this into their awareness in those moments when they're about to do their go-to response?
Mm-hmm. I think a couple of things. Prevention of these moments would be helpful. And so with the regular check-ins with yourself about how you're doing, how you're managing your stress, that might prevent some of the behaviors from occurring. There could also be something like maybe a note on your cupboard door, inside your cupboard door, to just ask yourself the question in a non-shaming way: what do you really need right now? And this does not play into the diet mentality. It's not about eating less or not eating certain types of foods. It's really about figuring out in that moment, are you physically hungry? Should you be nourishing yourself with this? Or do you want to give yourself a treat, which I wholeheartedly believe is okay to do at all times, but it really is another one of those quick check-ins with yourself, a reminder for yourself to say, why am I here and what am I doing? And then to give full consent to whatever it is that you're doing, because then you're emotionally aware of what's happening.
Thank you. That was very helpful. I'm also wanting to ask you more about self-compassion. You talked about that. I think this is a time when everyone is stressed and they may be impatient not only with other people or with their situation, but they may take it out on themselves. Can you say more about self-compassion?
Yeah. I think the practice of self-compassion is really an antidote to stress, self-criticism, and maladaptive perfectionism. So perfectionism that doesn't have a way to be flexible with self-expectations. And so self-compassion helps us look at ourselves as human beings, with the expectation that we're trying really hard, but perfection is not expected, cannot be expected, and that I can affirm what I'm doing well without having to be extra critical of myself for when I'm not doing as well, or not meeting my own or somebody else's expectations. And one of the statements I use is, it's human. It's human to sometimes struggle, or even often. It's human to not always be good at something. It's human not to succeed. It's human to err, and that's okay. And so finding a place of empathy for yourself in your heart, and then reminding yourself in those times when you feel stressed out or angry with yourself, using that kind of self-message, that statement, to remind yourself of how you want to treat yourself. So I think self-compassion is a practice, but it's also a decision about how you're going to approach yourself, the kind of relationship you want to have with yourself. If it's going to be one of empathy and self-support, and encouraging yourself to grow and learn and move forward, or if it's going to be one of cutting yourself down and criticizing yourself, and really kind of making yourself feel bad. And so that self-compassion is that decision of how you want to be in relationship with yourself, and then practicing that and reminding yourself of that over and over, really.
All right. Thank you. Can you talk a little bit about how people can get to the point where they are thinking about food as fuel, food as nourishment, instead of some of the other ways that they may be thinking about it?
Yeah. I think one of the ways to try and break that down a little bit more is really thinking about where our messages have come from about food and what messages we're taking in about food. Food really oftentimes gets described in a good or bad kind of way, almost as if there's a moral value attached to food. This food is good to consume, and this other type of food is not. Um, and I'm coming more from a perspective that I've learned from dietitians that I've worked with, that all food fits. It just depends on how much of it we use and a balanced approach to our eating and nourishing our bodies with what our bodies are needing. And so really thinking through, I think, what the messages are that people have heard about eating and food and what they want to believe about eating and food. Um, and and then going away from this classification of food into two categories, good or bad. And we work with patients with eating disorders a lot on that overly rigid classification of, there's either an okay food or good food, or there's a bad food. Really, really looking at that and deciding how you want to approach that.
Thank you. For our last question, I will start with an observation, which is that when you talk about emotional eating and stress, it seems to me that these approaches you're talking about could also be used for other times when we engage in other kinds of behaviors because we're having a feeling. Have you found that to be true, that this can apply to other things besides eating?
Oh, absolutely. Yes, that's a great question, a great observation. One of the one of the great things and the beauty of the mindfulness skills and the stress management skills and the emotion management skills are really that they can cut across the board, um, and be helpful for all kinds of behavioral choices that we're making, all kinds of decisions we have to make about how we manage ourselves and how we manage our relationships. And so learning about emotional self-awareness is not just helpful for making choices about eating or food intake. It's also helpful for when we're reacting to other people in our lives. And it's also helpful, when somebody's maybe wanting to quit smoking or wants to start an exercise program, so a behavioral health approach. But yeah, I think those strategies are useful and cut across the board. Absolutely.
All right, well, thank you. So I want to be sure and say thank you for sharing practical steps that we can all take to respond to the coronavirus. A recording of today's live stream, as well as links to additional resources related to this topic, will be included on the loop later today. Next time, we will be joined by Maggie Moore from the University of Iowa Employee Assistance Program. She will be discussing resilience and self-care during COVID-19. Until then, take care, and we look forward to seeing you soon. Thank you.